Hi, everyone. Today, for my global health presentation, I'm going to be talking about vaccines. Um, Specifically, I will end with talking about the COVID vaccine, but I kind of wanted to just talk about vaccines in general. Um, Vaccines are one of the single most important advancements in healthcare and have made a significant impact on global health. Diseases that once ravaged the world are now eradicated or extremely uncommon, such as smallpox and polio. Other diseases like measles and pertussis, which were nearly eradicated, have unfortunately made a comeback in recent years due to vaccine mistrust or hesitancy. Much of modern distrust stems from a now debunked paper written by Andrew Wakefield in 1998. He wrote a paper that had 12 participants, um, and he linked childhood vaccination with the development of autism and specifically the MMR vaccine, measles, mumps, and rubella. The research has since been completely discredited, and the article taken down, and he's lost his license and all these things. But all the misconceptions related to that paper that was published, they still remain. So there's kind of this postmodern context that questions the legitimacy of science and expertise and medical authority. And that contributes to some people believing that there's some type of conspiracy involving the medical community and big pharma, and that vaccines cause more injuries than are being reported, and things of that nature. In Canada, it was found that 5 to 10% of adults have a strong anti vaccination philosophy, especially when it comes to their children. Um, and media portrayal, particularly on the internet or via social media, has helped to fuel all of these beliefs as well. In fact, when you Google that Andrew Wakefield MMR paper that has a link, links MMR vaccines to autism, over 50% of the articles that come up on Google do not discredit the paper, and they do not state that there, in fact, is no link that has been found between these vaccines and autism. Personally, I do choose to accept legitimate research, and I trust what scientists and doctors have to say. I want to give myself the best possible chance of not contracting or dying from a preventable disease, especially one that has vaccinations available for it. I do not have children, but if I did, I believe that I would extend the same reasoning and that I would get them vaccinated, mostly because the risks of getting these diseases and the complications from these diseases far outweigh the risks of any adverse effects from vaccinations. So I would just want to give my children the best chance that I could to not have to deal with a debilitating disease. Um, Specifically with the COVID vaccine, I am very personally affected by the participation and results of herd immunity that could come from the majority of the population choosing to vaccinate themselves. Working in a critical care unit during the pandemic, during the worst of the pandemic, it was a really terrifying and sobering experience that I will never forget. Um, I was incredibly grateful and relieved when I was able to get both of my vaccines, and it was really frustrating at the time that I had colleagues that were refusing it. Um, Obviously, at this stage, the COVID vaccine is not mandatory, it's a personal choice. But it was difficult to have colleagues who had been right there with me, seeing the devastating effects of what this disease could do to people and do to our patients, and seeing people die, and the everything they had to go through, and my colleagues not choosing to vaccinate. It was tough. It was hard. And it also felt like it put me at risk because I share space with them. I'm next to them at the nurse's station. I'm with them in the break room, all of these potential areas where I could get exposed. And we had the vaccine available to us for free through our employer. And it was really difficult to see some of those people not choosing to get it. Obviously, there are other reasons why people are choosing not to get the COVID vaccine. Some of them are health related. Some people have a history of adverse reactions to certain vaccines, and so they're choosing not to do that. There's other reasons, such as, certain autoimmune conditions, which obviously are completely medically valid. Personally, I think that if you're in healthcare and have studied science and trust evidence-based practice, that I think you should get the vaccine. But obviously, personal choice. Some of the reasons why other people have chosen not to get the COVID vaccine, a lot of people think that there just hasn't been enough research into them and that they were rushed through. I can understand the perception of that, but I would also suggest for those people to continue to do research. And I would provide them with resources to be able to do that research. As the community becomes more vaccinated, we have had significantly less COVID patients in the hospital, less mortality, less people dying, and our case rates have dramatically decreased, which is beautiful and something that was hard to imagine back in the fall when we were just getting so hard hit. So it affects me, it affects the community. Globally, it's really important because a lot of countries that do not have access to as many resources are experiencing surges now. So right when the US and some other developed countries are now starting to see dramatic decreases because we have access to the vaccine, other countries, such as India, are just experiencing now the worst surges that they have so far during the pandemic. Just the other day, India had 350 positive cases in one day that were tested. Some of this has to do with new variants, but most of this has to do with not having access to the vaccine as well. And speaking of variants, viruses mutate, and so the longer that viruses are able to spread unchecked, the likelihood of new variants coming about is much higher. So the longer people or communities or countries do not get vaccinated, the higher the chance of more variants being able to mutate and then spread. So it has the people not getting vaccinated have huge consequences to this pandemic and the health and mortality of everybody around them. So yeah, regardless of where you are in the world, getting vaccinated slows the spread, and hopefully more vaccines will become available and people will want to take them more, and we can slow that spread. Okay. Vaccination is one of the listed UN's sustainable goals. And it's just because vaccines are one of the most important and impactful interventions in the prevention of disease, aside from clean water and sanitation. Preventing disease is our best chance at preserving global health, and vaccines play a key role. As a nurse, I have a duty to educate and advocate about public health. I have been taking the opportunity to speak with not only friends of mine, family members of mine, but also with all appropriate patients that I'm seeing in the hospital about whether they've been vaccinated, what fears they may have, what questions they might have, and hopefully be able to answer some of their questions and provide some evidence-based rationale on why vaccination is important and why it is safe as well. The recent setbacks that have come from the Johnson & Johnson vaccine that show some of those rare clotting events have, I think, been pretty detrimental to vaccine hesitancy. But hopefully, as people continue to see more data, that won't be such a problem, especially for the most vulnerable communities, that being able to receive a one-shot dose would be the best option for them, especially people that are perhaps unhoused, people that otherwise would have trouble getting back to a clinic, trouble being tracked down for their second shot. I've been able to convince a few coworkers to get the vaccine who were on the fence just by providing resources and educational materials. And I'll continue to do that for anybody who will listen. I hope that as more data emerges, that we can continue to reach higher levels of immunity and start to look toward a world that we had before the pandemic, mainly so I can give each of you a hug. One of the best resources that I've found, especially for younger people, people that have Instagram, is just in case anybody's curious, is an Instagram account called Two Dusty Travelers, TWO Dusty Travelers, and it's a nurse and a teacher, and they just have been so good at coming up with infographics and videos and just really breaking it down succinctly and following total evidence-based data, and it just makes it really digestible for people to understand. And so I've actually referred people I know, colleagues or friends or coworkers of mine that I know who were hesitant to get the vaccine. I've referred them to that Instagram page, and their minds have been changed. So if you need a little extra help, I suggest heading there. So yeah, get vaccinated. Encourage your family and friends to get vaccinated. Anybody over the age of 16 is now eligible, although it is fairly difficult to get access to those vaccines here locally. But again, over time, hopefully we will be able to jump over that hurdle. And in the meantime, continue to be safe and mask up and follow the rules, and let's get through this. Okay, thank you.